Bismillahirrahmanirrahim. The quote for today is it is health that is real, wealth and not pieces of gold and silver. Today we are going to discuss substance abuse. I am Dr. Wes and I am giving this presentation under the kind supervision of Professor Saira Afzal. The learning outlines of today's presentation will be the introduction of substance abuse, common drugs that are involved in substance abuse, levels of prevention, different programs to tackle the substance abuse, and the MCQ session at the end. By the end of this presentation, participants will be able to describe about drug abuse, levels of prevention, and its risk factors. Now, what is a drug? Drug is any substance that, when taken into living organism, may modify one or more of its function. This definition of drug is given by WHO. Now, what is drug abuse? It is self-administration of a drug for non-medical reasons in quantities and frequencies which may impair an individual's ability to function effectively and which may result in social, physical, or emotional harm. Now, the drug dependence is a state of psychic and sometimes also physical, resulting from the interaction between a living organism and a drug, characterized by behavioral and other responses that always include a compulsion to take the drug on continuous or periodic basis in order to experience its psychic effects and sometimes to avoid the discomfort of its absence. Now, what are psychoactive drugs? These are the substances that, when taken in or administered into one system, affect mental processes, for example, perception, consciousness, cognition, or mood and emotions. Now, coming towards the first class of drugs, that is amphetamines and cocaine. Amphetamines are synthetic drugs that are structurally similar to the adrenaline. In medical practice, they are used to treat obesity, mild depression, and certain behavioral disorders in children. The ordinary therapeutic dose is 10 to 30 mg once daily. These drugs act on the central nervous system. They produce mood elevation, a feeling of well-being, and increased alertness and a sense of heightened awareness because they give a tremendous boost to self-confidence and energy. While increasing endurance, they are called Superman drugs. The use of these drugs results in psychic dependence. Cocaine is derived from the leaves of coca plant. It was formerly used in medical practice as a potent local anesthetic. Cocaine is central nervous system stimulant. It produces a sense of excitement, heightened and distorted awareness, and hallucinations. No, barbiturates. Barbiturates are used for sedation. They are a major ingredient in sleeping pills. The addiction to barbiturates is one of the worst forms of suffering. It leads to craving or both physical and psychic dependence. No, the cannabis. It is most widely used drug today. Active ingredient in cannabis is hashish or charas or bhang. The dry leaves and flowering shoots are called bhang. Most commonly, the plant is cut, dried, and chopped and incorporated into cigarettes. It is also taken with drinks or incorporated into the foods or cakes. The most common reaction is the development of a dreamy state of altered consciousness, relaxation, euphoria, increased tendency to laugh, greater awareness of colors and sounds, interface with the perception of both time and space, and paranoia are among the psychological effects. No, the heroin, the most notorious drug. It is a narcotic analgesic. Addiction to heroin is perhaps the worst type of addiction because it produces craving. With narcotics, generally psychic dependence is strong and tends to develop early. Tolerance to narcotics also occurs rapidly, making it necessary to take increasing doses of the drug to achieve the same effect. Now coming towards the synthetic drug, that is lysergic acid diethylamide. It is synthesized in 1938 by Hoffman in the Sandoz laboratories in Switzerland. LSD is a potent psychotogenic agent. LSD alters the normal structure of perception. The individual perceives the world in a different manner. There is intensification of color perception and auditory acuity. Body image distortion, visual illusions, fantasies, and pseudo hallucinations are common. This is the picture that of a woman that a person assumes when after the intoxication of LSD. Now coming towards the alcohol. It is a sedative, tranquilizer, hypnotic, or anesthetic depending upon the quantity consumed. Within 2 to 3 months of consumption, it can be detected in blood. The maximum concentration is usually reached about 1 hour after consumption. Over the past 30 to 40 years, increasing percentages of young people have started to drink alcoholic beverages. Their alcohol consumption has increased in quantity and frequency, and the age at which drinking starts has declined. Worldwide, an estimated 2.3 million people die from alcohol-related causes. According to WHO, the estimated 2 billion people worldwide who consume alcohol are alcohol beverages. Unintentional injuries and suicides account for a large number of deaths due to alcohol. Now, no, Walker blood test work. It is used in driving by the police to see who are drivers who are drunk. It works. Uh, it detects the amount, percentage of aerosols of the alcohol in the breath. Now, there is also a agent host and environmental and triad for the drugs. Now, what are the host factors that are related to the substance abuse? Many attempts have been made to define the host factors. Studies employing questionnaires are structured into a report. Motives for drug dependence with descriptive words such as pleasure, desire to experiment, sense of adventure, wish for self-knowledge, and desire to escape. The average age of drug use had decreased considerably in recent years. Multiple drug use has also become more common. Now, the environmental factors. These are rapid technological developments with associated need for extended periods of education. Television, world travel, freedom to speculate and experiment have encouraged youngsters. Unemployment, living away from home, leaving school, one-parent families, larger urban environments, areas where drugs are sold, traded, or produced. Now, these are the report by the United Nations Office on Drugs and Crimes, that is abbreviated as UNODC. This is the UNODC World Drug Report 2024. These are the harms of world drug problem continue to amount amid expansions in drug use and markets. The number of people who use drugs has risen to 292 million in 2022, a 20% increase over 10 years. Cannabis remains the world's most widely used drug, and its users are 228 million. While the opioid users are 60 million, amphetamine users are 30 million, cocaine users are 23 million, and ecstasy users are 20 million. While an estimated 64 million people worldwide suffer from the drug use disorders, and only 1 in 11 is in treatment. Women receive less to treatment than men, with only 1 in 18 women with drug use disorders in treatment versus 1 in 7 men. In 2022, an estimated 7 million people were in formal contact with the police for the drug offenses, with often two-thirds of this total due to drug use or possession for use. In addition, 2.7 million people were prosecuted for drug offenses and over 1.6 million were convicted globally in 2022. Though there are significant differences across regions regarding the criminal justice response to drug offenses. Now coming towards the levels of prevention, there may be different levels. There are legal approach, there may be an education approach. Coming towards the legal approach, the legal control on distribution of drugs, when effectively applied, has been and remains an important approach in the prevention of drug abuse. Legislation may be directed at controlling the manufacture, distribution, prescription, price, time of sale, or consumption of a substance. Legislation restricting or prohibiting advertisement that directly or indirectly promote use of tobacco and alcohol has been increasingly common in recent years. Now coming towards the education approach. Education approach to the prevention of drug use and drug-related problems have been used in many countries. Education programs for school children and public information campaigns on electronic media. Community approach. The non-medical use of the drugs individually as well as in its mass appearance involves a complex interaction of drug man and his environment. The rapid changes taking place at the present time in relations between individuals, groups, and nations are also reflecting rapidly changing pattern of drug abuse in many parts of the world. There should be a strong emphasis on action at community level to prevent drug abuse. Now the treatment. Treatment cannot take place unless the individual attends for the treatment. Unfortunately, drug takers, as a rule, have little or no motivation to undergo treatment. Long-term treatment is not only a medical problem but needs the cooperation of psychologists and sociologists. Methods of identification of drug addicts and their motivation for detoxification requires hospitalization, counseling, and follow-up. The patient must effect a complete break with his group, otherwise the chances of relapse are 100%. No, psychotherapy has a valuable place in the management of the addict. Rehabilitation. Relapses are very frequent in the treatment of substance abuse abusers. Facilities for vocational training and sometimes the provision of sheltered work opportunities are useful in rehabilitation and help to prevent relapse. No, the International Day Against Drug Abuse and Illicit Trafficking. The World Drug Abuse and Illicit Trafficking Day is marked on 26th June every year. This day is celebrated to strengthen action and cooperation in achieving the goal for a world free of drug abuse. No, the UN Sustainable Development Goal number 3, Target 3.5 sets out a commitment by government to strengthen the prevention and treatment of substance abuse. Several other targets are also of particular relevance to drug policy-related health use issues, especially Target 3.3 referring to the ending of the AIDS epidemic and combating viral hepatitis, Target 3.4 on preventing and treating non-communicable disease and promoting mental health, while Target 3.8 on achieving universal health coverage. These are the various laws and acts that are available in Pakistan at the federal and at the provincial level. These are the Dangerous Drugs Act 1930, the Opium Act 1857, the Opium Act 1878, the West Pakistan Prohibition of Opium Smoking 1958. While the Punjab laws are the Punjab Excise Act of 1914, the Sindh Brewery Act of 1878, the NW Prohibition Act of 1938, and the Balochistan Control on Possession and Consumption Act of 1973. Yeah, according to the Pakistan law, it is an offense to possess, manufacture, transport, import, export, and sell any dangerous drug or undertake cultivation, collection, and adopting of for smoking opium hemp, or coca plant. Violation is punishable by up to 2 years of imprisonment or a fine of up to rupees 2,000. No, the National Anti-Narcotics Policy. The policy objectives are to is drug supply reduction, drug demand reduction, and international cooperation. Now, the factors that are responsible for increase in drug abuse in Pakistan, there is increased availability of drug at low prices, rapidly changing social norms, lack of job and economic frustration, lack of proper interest in education, peer pressure, and negligence of parents, lack of drug education within the family and in education institutes, apathy on the part of community leaders in responding to drug abuse symptoms. Now, Islam and harm reduction. Although drugs are haram and therefore prohibited in Islam, illicit drug use is widespread in many Islamic countries all over the world. In the last several years, increased prevalence of this problem has been observed in many of these countries, which has in turn led to increasing genetic drugs, as seen in HIV and AIDS pandemic across the Islamic world. While some countries have recently responded to the threat through the implementation of harm reduction program, many others have been slow to respond. In Islam and Quran, the prophetic traditions or the Sunnah are central sources of references for the laws and principles to that guide Muslims' way of life and by which policies are made. This is the Islamic perspective regarding the substance abuse. No, Pakistan has no depth of law enforcement agencies. There are laws, there are policies, and there are systems in place. But unfortunately, there are many systemic weaknesses. No, why Pakistan cannot reduce the tobacco smoking campaigns? Because the Pakistan's reliance on revenue generated from tobacco is a barrier to effective tobacco control. According to one report, the revenue generated from the tobacco business is 8.3 billion that contributes about 6% of Pakistan economy. Now coming towards the recent updates, the first article that is chosen is effects of a parenting focused mindfulness intervention on adolescent substance abuse and psychopathology. That is a randomized control trial. The key points from this study is the study is conducted to assess whether a parenting-focused mindfulness intervention can prevent increase in adolescent substance use and psychopathology. The participants in this study are 96 mothers of adolescents aged 11 to 17 years, that were randomly assigned to either the parenting mindful intervention group or a parent education control group. Intervention details. The parenting mindful intervention aimed to reduce parent stress and improve parenting practices through mindfulness techniques. The findings. The PM group, mindfulness group, showed a prevention of increasing adolescent reported substance use over time compared to the education group. Mothers in the mindfulness group reported a prevention of increase in their adolescents, externalizing symptoms, for example, aggressive or disruptive behavior over time related to the education group. No significant effects were observed on adolescent internalizing symptoms. The mechanism. The beneficial effects on adolescent externalizing symptoms were partially mediated by increase in mothers' mindfulness levels post-intervention. Now, what are the challenges? Despite high satisfaction rates among participants, attendance was low, with only 31% of mothers attending no sessions. The conclusion is that parenting focused mindfulness interventions may be effective in preventing increase in adolescent substance use and externalizing behaviors by reducing parental stress and enhancing mindful parenting practices. Now, the second article is leveraging driver vehicle and environment interaction, machine learning using driver monitoring cameras to detect drunk driver. This study is conducted to develop a machine learning system that utilizes driver monitoring cameras to detect critical blood alcohol concentration levels in real time. The methodology is that the system captures data on drivers' gaze behaviors and head movements using in-vehicle cameras. Machine learning algorithms analyze this data to predict whether drivers exceed specific blood alcohol concentration threshold. The system was tested with 30 participants in a driving simulator study. The finding, the system effectively identifies alcohol impairment by monitoring psychological indicators such as eye movements and head posture. It leverages existing driver monitoring technologies which are becoming standard in modern vehicles due to safety regulations. The implication, this approach offers a promising avenue for real-time detection of drunk driving and potentially enhancing road safety. Integration into vehicles equipped with driver monitoring cameras could provide timely alerts to prevent alcohol-related accidents. Now coming towards the MCQs. First MCQ, a 35-year-old man reports that he cannot start his day without consuming a substance that gives him a feeling of heightened awareness and increased confidence. He has developed a compulsion to use it regularly to avoid discomfort. What substance is most likely responsible for this dependency, whether barbiturates, amphetamines, cannabis, alcohol, or heroin? Its answer is beta, that is amphetamine. Second MCQ is a 40-year-old man uses sleeping pills and he is dependent of sleeping pills. He experiences craving and psychological dependence when sleeping pills are not available. The substance most likely to present in his sleeping pills responsible for his behavior is whether amphetamines, cocaine, barbiturates, cannabis, or LSD. It is barbiturates. The most common substance abuse globally, which is dried and can be used in cigarette and cause relaxation, euphoria, and increased tendency to love, greater awareness of colors and sound, interference with the perception of both time and space, and paranoia in user is amphetamines, cocaine, barbiturates, cannabis, or nicotine. It's cannabis, the option. A 22-year-old man consumes a substance during social gathering that alters his perception of time and space, makes him laugh more, and increase awareness of colors and sounds, which drug is most likely, whether cannabis, cocaine, LSD, heroin, or barbiturates. Cannabis. A teenager starts using psychoactive substance after moving to a large urban area where drugs are readily available. Which of the following is a major environmental factor contributing to his substance use? Whether unemployment, one-parent family, living in a drug trade hotspot, rapid technological developments, or educational pressure. It's living in a drug trade hotspot. A psychiatrist faces difficulties in treating a heroin addict who relapses frequently despite detoxification. What key factor may improve the patient's chances of recovery? Whether continued psychotherapy without social change, encouraging gradual drug reduction, maintaining connections with drug using peers, complete separation from drug using grouping, or vocational training without treatment. It's D, complete separation from the drug using group. Seventh MCQ, a college student experiments with the drug that causes vivid hallucinations, body image distortions, and pseudo hallucinations. What drug is most likely responsible for this effect? Whether cannabis, amphetamines, LSD, barbiturates, or cocaine? It's LSD. Eighth MCQ is a community leader wants to reduce the drug abuse in his locality by addressing its root causes through awareness and education campaigns. What approach is adopting, whether legal approach, treatment, rehabilitation, education, or screening approach? It's the educational approach. A 32-year-old ex-drug user struggles to reintegrate into society despite completing detoxification. What rehabilitation strategy can prevent relapse, whether detoxing alone, continuous psychotherapy, vocational training, and sheltered work, signify comorbid condition, or prescribing anti-anxiety medication? It's the screening for comorbid conditions. 10th MCQ is a 35 years old female was not following traffic rules in Europe. The police stopped the car. The gait and speech of the female is slurred. The best and quickest screen test to find out if she was been done excessive alcohol consumption is whether alcohol blood test, alcohol blood test, stomach test, minimum and state examination, or alcohol urine test. It's the alcohol blood test. This is the key to the MCQ. This is a YouTube channel by the name of Community Medicine, England Medical University. It is all the videos by the postgraduate residents from the Community Medicine Department of King Edward Medical University are uploaded here. You can watch any topic related to the community medicine here in this channel. And thank you very much for today's presentation.